Today, inshallah, we're going to talk about depression and Islam. I think if people know what Allah said about the creation, they will have less trouble understanding depression, and they will have easy way out of depression if they are. But the important one for majority of you is actually to know how to not have depression, how to defeat gloomy thoughts in your mind and defeat the depressing thought and to defeat the anxiety which come with it. So as you know me, I'm Dr. Issam Ghannam. I'm a psychiatrist, and I was chest physician as well, and an imam, alhamdulillah. I learned Islam in Syria and in many other places. You can sit in the middle. There's no rules. There's no corona fear. So you can sit in the middle. There is a lot of spaces in the middle. Yeah, there's middle there, and there's 3 chairs here. Now, what I want to say that is depression disease of the body or the soul? The soul is a religious concept. Doesn't exist in medicine. So you don't have. When you do anatomy, you don't find the soul located in any part of the brain or the heart or anywhere. So it's a totally religious information, and Allah Azza wa Jal told us, يسألونك أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم يسألونك عن الروح قل الروح من أمر ربي وما أوتيتم من العلم إلا قليلا. It's a matter belongs to Allah Azza wa Jal, and you have been given only little of knowledge. When they ask you about the spirit, when the spirit outside the body is called ruh, when enter the body it becomes the soul. So the soul is the spirit inside the body, and it is you. So every soul has to sit quietly, and every soul has to listen. I'm not talking to the body, I'm talking to the soul. You control the body. So you, the soul, is the driver, and the car is the body. If the body is functional, you can use the body. If the body is no longer functional, it depends what you lose in the body. If you lose the engine, you need a new engine, which is, now they might give you a new heart, can't give you a new brain yet. Some people are functioning without a brain. Amazing. That's a joke. But there were some, one guy that was born without a brain. You put the torch here and the light come from here. But he grew a brain. I showed you the video here some time back. Is your brain really necessary? So that's sure that wasn't 25% probably. So when the car is no longer usable, the angels come and take the driver, or they take the soul, or take the spirit. If the car missing a wheel or whatever, then you can put a new wheel, or you can drive with 3 wheels, or only fool horses always have 3 wheel cars. Might need to get some. There's 3 chairs here in the front, sisters, and we'll see how it goes. Allah Azza wa Jalla said, أعوذ بالله من الشيطان الرجيم يا أيها الناس اتقوا ربكم الذي خلقكم من نفس واحدة وخلق منها زوجها وبث منهما رجالا كثيرا ونساء. So mankind, be mindful of Allah Azza wa Jalla, the Lord who created you from a single soul and created of its like, is similar to it. So if Allah created us from a single soul, which is the spirit, it's not the Eve created from the spirit. It has their own spirit. And when the soul enters the body, it's called soul. So it's spirit outside the body. And from both he scattered countless men and women. If you know Arabic, you know that created you from nafsin wahida. It's a female. So the soul, the spirit outside the body, it's dressed as a single female. So he didn't create you from Adam, which usually spoke about in the male. Nafs, wahid for the male, wahida for the female. So he didn't create Adam from Eve, neither created Eve from Adam. وَخَلَقَ مِنْهَا, of the same type, زَوْجَهَا, its partner. So زَوْجَهَا is not a male here. Zawj is the male zawj and the female zawj. When they translate, they make a lot of mess. And in the hadith, the Prophet ﷺ said that when you are 120 days old, an angel come and blow into your body the spirit, الروح. breathe into it. The spirit breathed into it. And a strong hadith in Bukhari and Muslim. So you are now a spirit by the body. Now, when you go to the other hadith, Allah Azza wa Jalla addressed you as a spirit inside the body, that your body have rights from you. So he looked into the body separate, the hadith. He's not saying you have right towards yourself. He's saying your body have rights. So you need to look after your heart, your kidney, your lung, your liver, your blood, your weight, your food. That's the right of your body. So Allah addresses you as a spirit, as a soul. Obviously, he said, and your eyes have the right from you, and your wife have rights. And so, is the mentally ill majnoon or mad? Majnoon is in Urdu, I understand, isn't it? The word is used in Urdu. No? Yes. This is yes. This is no. This is Bill. What's his name now? Joe Biden. Boris Johnson. Keep changing. You can't keep up with the names. I mean, they sacked the treasurer. He's been appointed only a few weeks ago. So the Prophet ﷺ was sitting, and a man walked, and they said Majnoon about him. People sitting with him, and they said he's Majnoon. He said no. إنما المجنون المقيم على المعصية ولكن هذا رجل مصاب. Majnoon who continuously disobey Allah. This man is ill. So there is a lot of debates between philosopher and scientists and sociologists and psychologists, and do you have a body and soul, or do you have only a body? But, they call it dualism, body and soul, or productive physicalism. So, and debate's still not settled. They still debate it. Unless you come and take the soul and show it to them, they wouldn't believe. But the soul is not to be seen. It's not a matter. It's a spirit. And we don't know. Allah put the spirit. And there's one of the meaning of the hadith that Allah created Adam in his own image, that Allah Azza wa Jalla created Adam with the ability to have insight into himself and see yourself from outside. The psychologists call it the inner eye, as if you're seeing yourself from outside. Before you leave home, make sure that you're well dressed, dress are matching, your shoes are okay, your hair is fine. If you shave, you shave. If you don't, you just make sure that it's clean, whatever. And you cut your nails if you are a male. But I mean, there's a lot of things you look at yourself from outside. Animals don't. You haven't seen a cat, even when they see the mirror, they start fighting the mirror because they think it's another cat there. How dare you come to my house and things. So, spirits need intact body to function well. Vital organs like the brain and the heart and all senses, the organs. So you might, vital organ diseases that reduces the spirit's control to the body is the brain and the heart and all senses, sense deprivation. When you don't have enough eyesight, enough hearing, enough, when somebody is toxically confused, when people are like, you might get, elderly might get constipation, become toxically confused, having low self-esteem, feeling tearful, feeling guilty, that it's your fault and you should have done this and you shouldn't have done that. Now, when you are depressed, your brain will produce less hormones in the brain, and the brain become like overwhelmed by negative thoughts and negative ideas. So it's not easy to defeat it and push it away unless you're being trained from young age. Because if you are not trained, then you fall victim to all these, sad ideas and bad feeling and things. So this is important that we train you. We actually, one of the things I used to use is cognitive behavior therapy. Train the person to recognize this thing's happening to me, I can't control it, and because I'm not thinking logically, this is overcoming me. When you think logically, like somebody comes saying, "Oh, I'm going to die, I'm going to have a heart attack, and I leave my children, I leave my wife, and I have a lot of debt, and the bank will take the house," and all these gloomy ideas become like a chain of thoughts and like a train, one after the other, like a domino. So I sit down, okay, why you think you have a heart attack? Or you will have a heart attack? Do you have high blood pressure? No. Do you have high cholesterol? No. High glyceride? No. Do you have blood sugar, high blood sugar? No. Do you have, are you overweight? No. Do you have a strong family history? No. Do you have high uric acid? All these contributors to the heart attack, they're not there. So why are you logically convincing yourself you have depression? Yeah, probably not. And we ask them to rate themselves when they start talking. How much percent you think? Oh, I'm 90%. After the discussion becomes 60%. The second session becomes 50% and 30%, then disappear. So it wasn't actually heart attack. Or I'm going to be bankrupt, or my wife is going to leave me, or I'm losing my money, or whatever, am I losing my job? So you need logically to discuss all these with them. Bring them into reality. Another one, feeling irritable and intolerant to others, and having no motivation or interest in things. By the way, all these actually you can get it from nhs.net. They educate the general public, and there's a lot of information there, and they're always updated, so it's always something coming to it. So I didn't bring what I was taught in Nottingham 25 years ago, so 40 years ago. It's all fresh. Finding it difficult to make decisions. Concentration will be lost. By the way, the more depression in older age than younger age. So one of the things they do, they retire you. You think, why they retired me? I'm still, but you're not noticing. You've been a bit low, a bit sad. You've been very slow making decisions. We had the Sherry Farm Community Center, the door handle broke. And I spoke to the lady, and I spoke to the lady again and again, and after 3 months, then she managed to get it done. The other door handle broke, and then I found her even more, and they said, oh, we sacked her. Because she wasn't doing the job. Taking information and just throwing it in whatever shelf and things. But if you assess her, probably she is depressed, probably she needs treatment. But business people, they can't afford just to get no job done. Or they do something else elderly, like the cognitive functions, the executive functions in the front. They come to the work and what to do next, I don't know. You've been doing it for 30 years, but he lost these frontal lobe things. So the soul is fine, the spirit is fine. He's a nice person, everybody likes him, he's a really good person, whatever. But he lost the brain to use it to start working. So you haven't got the machine, you haven't got the car working. There's a lot of wires there. And feeling anxious or worried, or not getting enjoyment out of life. This is very important. If people say that, we call it anhedonia, I don't know why they call it anhedonia. They're not enjoying life. They're not. You have the money, you have the house, you have the wife, you have the job, you have this, you have friends, you have the. But you're not enjoying the life probably because you are depressed. So go and find out. Feeling anxious or worried, and obviously you will, because you're not performing, you're not actually doing things. You should be at work at 9 o'clock and you're still in the house. And like this mother, trying to convince her son to go to school. You need to go to school. It's already 8:30. You expect you there 8:30, and nobody likes me there. Everybody hates me. Everybody could shout at me. You have to go there. You must be there. No, I don't like the school. And is he depressed or not? He said, you're the headmaster. He was depressed. So the headmaster, depressed, didn't go to school. He didn't catch a joke, did you? You are the headmaster. Having suicidal thoughts. That's really alarming to people, especially if they are religious. I had the imam when I was in Wales, and he became very depressed with a lot of suicidal thoughts. And he became more disturbed, being imam, to have ideas to kill himself. So I took him and I spoke to him, and I did with him some cognitive behavior therapy and things, and he's fine. It's not you. Your brain only full of these negative thoughts. All these, stored information, you're only digging into the negative side of it, the depressive side of it. We had the medical team actually asked me to see him. He was very disturbed, and was on medical board, and his brother committed suicide in Nigeria, and he thought he was Muslim, and his brother going to hell, and he was sad that his brother going to hell, and so I saw him and I said, you could have suicidal ideas because a lot of things, depression one of it, manic depression one of it, schizophrenia one of it. You could be, reacting to certain things. So you are ill. ليس على المريض حرج, Allah said in the Quran. So marid will not be blamed. So that's important. Moving or speaking more slowly than usual. Changes in appetite or weight. You either eat too much or too little. You could have constipation, you could have unexplained aches and pain. When I came to Britain and I did psychiatry, I discovered that we saw a lot of people in Syria with stomach ache, back ache, and they were depressed. Looking back, they fulfilled the criteria for depression. But because depression is not actually understood by people and they don't like to look into mental illness. I'm not mad. When I went to treat people in North Syria and Jordan, for post-traumatic stress disorder, I had difficulty getting people to see the psychiatrist. I'm not mad. No, I need to go see mad people there. So I said to the guy who is responsible for the camp, I said, do you have people who can't sleep? Yes, many of them. Get irritable? Yes. Get angry? Yes. They shout very easily? Yes. I said, these people I need to see. These are the who fulfill the criteria. In 50 minutes, they're better. And they go, thank you very much. Nam.
Yeah, these symptoms which you are explaining, sometimes it comes and sometimes goes.
It has to stay, as I said, for 2 or 3 weeks or more. Symptoms come for a few hours, few days, things resolve. There's a hadith, القلوب بين أصبعين من أصابع الرحمن يقلبها كيف يشاء. The heart is between 2 fingers of Ar-Rahman, Allah Azza wa Jal, He turns it as He likes. So you might be yourself, nothing to upset you, but you feel really unhappy, sad. So here where you need to use your cognitive functions. Why I'm sad, there's nothing there, and blah, blah, blah. And then I haven't been sad for that long. So I need to be for a long time, 2 weeks, 3 weeks stretch. So unexplained aches and pains sometimes could be depression. Stomach ache, back ache, quite well known to be caused by depression. Lack of energy, low sex drive, loss of libido, and changes to the menstrual cycle in young ladies and disturbed sleep. And that's really important because you find it difficult to sleep, or you sleep and wake up, or sometimes you sleep too long. But the difficulty in sleeping, and that's continuous. And early morning waking, it's known to happen. Avoiding contact with friends, taking part in fewer social activities you run away from. I always thought, people don't come to Maghrib and Isha as I expect. Probably all of them depressed, isn't it? Because you don't see the social withdrawal. Neglecting your hobbies or interests, having difficulties in your home, work, or family life. So you need to look into, even you might be, professional, you might have, but the life changes every day, and then your hormones change, and you're getting older, or getting illness, or getting children leaving and coming, and grandchildren, and you might have changes in your mood. But to become clinically depressed, things has to be beyond the expectation of the effect of daily life. Depression can often come and gradually, so it can be difficult to notice something is wrong. Many people try to cope with their symptoms without realizing they are unwell. It can sometimes take friends or family members to suggest something is wrong. Because when you are living with a person, is gradually switching off things. But when somebody coming from outside say, "Oh, what happened to you? I haven't seen you in the club. We haven't seen you in the gym. We haven't seen you in the mosque." And I don't know if I say the mosque or not, but doctors describe depression by a series of things. Mild depression has some impact on your daily life. Moderate depression has a significant impact on your daily life. And severe depression makes it almost impossible to get through daily life. a few people with severe depression may have psychotic symptoms. And that's what makes people really too worried. They might hallucinate, they might hear things or see things, they might have bad taste, they might have, changes in senses. What worries them sometimes, the psychotic symptoms, like hearing voices or seeing things. It does happen when you have psychotic depression, because there is also, element of psychotic symptoms there. It can be difficult to distinguish between grief and depression. This is why grief, subhanAllah, Allah Azza wa Jalla wanted the person who loses a loved one, the wife, to be in iddah for 4 months and 10 days. And when I came to the country, I found that there's a lot of them, they have difficulty coping with the grief, and the grief become like pathological grief and stretch for a year, 2 years, 3 years, they can't sort it out. So grief in Islam has to be looked into. If it's happened, Allah allowed it to happen, and it gets on with life. And the Prophet ﷺ, when he lost his son Ibrahim, he said, إن القلب عين لا تدمع وإن القلب لا يحزن وإن على فراقك يا إبراهيم لمحزونون. That the eye will shed tears and the heart will be sad, and we are really sad that we lost you, Ya Ibrahim, talking to his son. And the grief is entirely natural response to a loss, while depression is an illness. Now, this is why we have in Islam the 4 months, 10 days for the ladies, and obviously the men also go through the grief. But the mood component, you need to look into it separately, and a lot of other biological changes person go through. People who are grieving find it difficult, feeling of sadness and loss come and go, but they're still able to enjoy things and look forward to the future, and they carry on with their job, they carry on with their family life, they carry on with a lot of activities. In contrast, people who are depressed constantly feel sad and find it difficult to enjoy anything or be positive about the future. I said in the beginning, there's something in hedonia. You are not enjoying anything. You will just eat because you just have to eat to survive, but you don't enjoy your best food, your best meal. You don't enjoy any of your favorite program on telly or games, or even driving the car when you used to enjoy it. Now you just have, you don't feel, and you can meet, obviously, if you go to the site. Postnatal depression does happen, baby and ladies who give birth, and that's usually disappear very quickly. I notice, our culture in the Middle East, that they have a lot of things happen within like the first few weeks. They have aqiqah, and they have party, and they have cut the hair, and they have circumcision. They have a lot of activities, and they get a lot of celebrations. So the lady feel really, I produce something really important. Because natal depression, I've seen people who became depressed because she feels she brought to the world a human being. Can I look after him? Can he survive? Can I feed him? Can I dress him? Can I protect him? Do I have the ability to earn money? And can I, social service might take him? And so they sometimes become severely depressed and they kill the baby. So we see a lady who is very depressed and gave birth to a child. We sometimes take the child from her until she gets better, and we keep the child because she might suffocate the child. I saw a man who became very depressed and said, "Why are you depressed?" He said, "My wife expecting." So what? The cost, the rent, this, and something. That obviously over-exaggerated the problems. And Allah Azza wa Jalla said in the Quran, there's 2 ayah, ولا تقتلوا أولادكم خشية إملاق نحن نرزقهم وإياكم ولا تقتلوا أولادكم من إملاق نحن نرزقهم وإياكم. So the one ولا تقتلوا أولادكم خشية إملاق, you're not poor now, but if the child come out will become poor, they kill the child. Okay, doesn't want to have the burden of financing the child or spending on the child. And the second ayah, ولا تقتلوا أولادكم من إملاق نحن نرزقكم وإياهم. So the first one, Allah will give you the money to look after the child before the child is born. The second ayah, Allah will give you the money to look after the child. So whether the child is born or not, if he wasn't born, Allah will give you in advance. If he is born, Allah will give you soon. But you shouldn't kill your child. So it doesn't mean that you could go and have 10 children because I will have money with every child. The more bonus from Allah. It's not, doesn't work like this. Some people in Syria actually believe like this. They say the child come with the money come with him. So how about many? Have 9 or 10. Bipolar disorder, when there are people have mood swing, they sometimes be depressed or sad or high in mood. Seasonal affective disorder, some people become sad in the winter or less light. I usually give them lux light to sit 4 hours a day and read while they're exposed to the light. There's no single dose for single cause for depression. There's a lot of theories about it, and it's triggering factors as well. But there's known to be probably depletion in the amount of hormone in the brain, or the amount of hormone crossing the synapses from a cell to cell to cell. So most of drug companies concentrate on increasing the amount of neurotransmitter hormones which passes from cell to cell to cell. Sometimes become like, so difficult to get this channel open for the neurotransmitter hormones, and sometimes we need, if severe depression, we need to give them electric shock to open these channels. And if it's correctly diagnosed and correctly prescribed, it does work. I mean, I had a guy who was extremely depressed from Salihal here, and he was urinating standing. All his social inhibition gone, and he's not looking after himself at all. He's a manager of a company, and I wasn't convinced he was dementing. So we gave him the antidepressant, and I gave him electric shock, and he actually managed to go back and live at home for another 7-8 years. So it could be so damaging to the person that he appear like he is demented, but because there's no channels at all, so the electric shock open these channels. They don't know 100% how it opens it. Obviously, the person reacting to a lot of life events like bereavement and divorce and illness and redundancy in job. Like if you take the loss of a partner, a loved partner is 100 points, moving home is 45 points loss, losing the job 50 points, having Christmas 25 points. So it become like, or Eid, or so this is that, if you are trained to fight depression, and life is going to be rosier, don't worry, it's happened everywhere, everybody how. I mean, they kept asking the chancellor why this is happening. He said, it's happening in every country. Why you were sacked? It's not every country sacked their chancellor. Different causes could combine together to make person more ill and severely ill or quickly ill and depressed. People talk about downward spiral. If you don't get treatment, you get from bad to worse. Obviously, you need to catch a person very quickly and get them out of the depression lake, sinking in it. Some studies have suggested that you are more likely to get depressed as you get older. When somebody becomes depressed, if he is past 65 or 70, I always give them antidepressant for life. Because the amount of hormones with the brain shrinking and activity is much less, they're not going to fight it and succeed. They always need some boost. Like the memory, when you have, we need to give talk on memory. How could you get your memory always sharp? You need to get your brain always sharp. And how you get your brain always sharp? Go back to school. I'm 56, I'm 60, I'm 70, yeah. And one of my teacher's student, Sheikh Ramadan, he managed to get PhD, became a doctor when he was 88. He's now 108. All our teacher died, all his students died. My own teacher, he's 93 now, And this teacher, he actually teacher of my sister, she loved his way of teaching. He's 108. He's still active. When we were building the Institute of Abu Nur in Damascus, he would be everywhere. He would be synchronizing all the work. So he's imam, and has family, and he always have something, fresh to think of or learn. So imagine you applying and you've got PhD 88. So there's ways to get the memory. Stressful events does exist. Many people have, but how you train yourself not to get affected by it is going to be difficult for us. Me teaching you today individual things, how to. Now personality, people who are more vulnerable. Personality, using your soul, the soul using the body to acquire information and build knowledge on it and have a personality, more or less. Now a lot of people get the wrong education at home, the wrong interaction, the wrong people to look after them. And the example they give you, like how would you get a split in personality? You give your children 2 double-bind messages, so he's puzzled. What do you mean? Am I supposed to be this or this? So go outside and pray, and play outside. Get out of my face. And then if you go outside, I will do this and this. So the child, which one? Especially with children, they have difficulty reading your subliminal messages. They only know the vocal things. You told them this, you told them that. So the boy came and he brought his father a tie, and he thought that he would please his father, and he was on his birthday. And he came, and the father has a party, and his friends there, and all enjoying themselves. And the child come and give him the tie, and take the tie, throw it away, and carry on talking. They said at that time the split of personality happened. That the child must have collected money and made an effort to go and buy dad a tie to please him, and then the tie thrown. This, when I trained in psychiatry, a lot of things I trained wrong back home. When a child talks to you, you stand, give him all your face. Prophet Muhammad ﷺ was like this. Anyone sitting, he think he's directing attention to him. So Amr will ask him to the Prophet ﷺ, he thought that he's number one, because he's giving him so much attention and things. And he said, who you love most in your life? He said, Aisha. He said, no, from the men. He said, her father. He said, then who? He said, Omar. Then who? Uthman. Then who? Ali. Then who? Sa'd ibn Abi Waqqas. Then who? And then he reached 20. He said, okay, let's stop. I'm 21. He didn't, because he wasn't number 1, 2, 3, 10. So how was the Prophet ﷺ able to get everybody's admiration that he's getting his attention? And that's very important when you talk to children. I mean, I was yesterday with Talha's son, and I kept looking eye to eye till he kept staring at me, and looked at me. This guy is really interested in me. The same I did with Maryam the other day, Marwan's daughter, and she kept looking at me. And you need that to build up a normal personality. When you go to a lot of homes, they get the child twisted from the childhood, from the toddler's age. So there's no age you say he can't. One of my granddaughters, she used to come in the morning and sit on my lap. We both watch. I can tell you all the rhymes now, all the nursery rhymes and all the games and things, and then we read the stories and then she was, granddad went to go to the nursery or to granddad, grandmom. No, granddad and grandmom. So personality is important to build from as early as infancy, actually. And if someone in your family has had depression in the past.
Worth mentioning just one point about something called adverse childhood experiences. So it's a known phenomenon that children who suffer or experience or witness physical, emotional, psychological abuse, it's known that this leads to trauma later in life, and that could be physical or mental health disorders.
Yeah, I saw a girl in my clinic and said, one of the questioning, what's your religion? She said she goes to the Satanic church. Who's your God? She said, Shaitan. Why you say that? She said, because her father go to church and he was abusing her. So he must be that God is the wrong one and Shaitan is the right one. And that, you can't check it in her brain. This is, so obviously you need long time and long therapy. Then I use, when I first started psychiatry, and I did my training in psychology in Nottingham, and the system there at that time that they give you a patient, you have 6 months to get the patient treated and discharged. If not, you have to come back. So I looked at the book and somebody 450 weeks, which is nearly 5 years, seeing that, or more than that, 9 years. And that's 200 weeks. And so what shall I do? They gave the other doctor with me, were two of us. She took a patient, I took one. Mine was drug addict, alcoholic, criminal, living with his common law wife. They have 3 children, depressed, this is full of things. So I was, and they have to record the session. And then the supervisor listens to the recording and then comes back and correct you. This and this. Psychoanalytic psychotherapy. And then her patient, my colleague, became more depressed, admitted to hospital, wanted to kill herself. And my patient discharged after 4 months. And she came to me, she said, he's really better, he's well and discharged. You haven't used the information we teach you, but he got better. So I was using mixed of, I didn't say to him, this is from Islam, this is what the Prophet said. No, the Prophet said, لا تقولن لو أني فعلت كذا وكذا لكان كذا ولكن قدر الشيء الله وما شاء فعل. When something bad happened, the Prophet said, don't say, if I did this, this happened, if I only did that, if I don't, because that will become like a chain of bad to worse to worse. What you say, Allah agreed for that to happen, and it happened. قدر الله وما, Allah decided that's what you, we remember from history, I witnessed an incident where the person was really bitter, feeling bitter about something, and Allah punished that guy who caused that bitterness. So, but if you know what Allah Azza wa Jal, how Allah run His universe, you'll find that I couldn't change the events. I've done this wrong, expect Allah Azza wa Jal to correct it. And that will be a hit to you, yeah? And I should get better next time. Family history could be giving birth, as I mentioned, postnatal, loneliness. This is why, if you're a Muslim coming 5 times a day to the mosque, also ladies go to the mosque because the Prophet ﷺ said, let ladies leave the mosque first. And they used to go out of them first in Fajr, or Al-Zuhr, Asr, Maghrib. We have people who don't like seeing a lady in the mosque. When we were in Leicester, my wife went with a new Muslim to the mosque, and they wouldn't allow them in. No. Oh, my wife said, you're not teaching me the religion. But they wouldn't, have to come back. Drinking alcohol, drugs could cause depression. Alcohol and drugs, illnesses. I'm skipping through these because I want to go to the survey. And the end and question. I'm not going to take question. I'll show you the survey first, inshallah. The survey, what I did, I sent the questionnaire to all the Muslims on my list, and I had 43 replies. So all Muslims. Thinking about the last 2 weeks, to what extent have you found difficulty focusing on everyday task? Some of the time is 21 out of the 40. This is the 42, the result of let me see. Yeah, half of them, and 4 never, and 8 nearly all the time, and 9 most of the time. So if you add some time, that the breast, but I'm managing to cope, and these are fine, nothing wrong, then you have at least a third of the sample who are quite depressed. Obviously, if it lasts for 2 weeks or 3 weeks. Finding no joy in life or feeling like you never will again. That's the 42 sample, yeah. Some of the time, because one actually sent the results today, and because I published already the report and didn't add that person. Some of the time 18, 10 most of the time, 8, 9 never, and 5 nearly all the time. So if you add 5 to 10, 15 need treatment. If you look into being lethargic and having no energy, some of the time 20, but you need to add these 7 nearly all the time and 10 most of the time, so you have 17 need treatment. Try not to treat depression on your own unless you are expert, because why to take you 2 years to get better if you can get 6 weeks, 12 weeks? I mean, especially when we use treatment, tablets usually take 3 to 6 months to work, and we say to people, stay on it for another 6 or 9 months. So it's nearly a year. I worked in both. I was looking after coronary care units and cardiology in the early life, and the patient come with fast heart or some problems, with the rhythm and things, and we give injection in the vein, and they get better within 30 seconds. To the other side of medicine, we give medicine and we wait for 6 months to start working. So mental illness takes a long time to cure. I had a patient from the north of Solihull, and she was depressed for donkeys of years, and then was referred to us and depressed, want to kill herself, this and that. So a lot of treatment didn't work, and then I combined the treatment together, and it takes 6 months to get better. And I had a nagging community psychiatric nurse. Oh, she's not better. Every meeting we come, no, she's not better. Wait for 6 months. We started in February, we end in August. Oh, not better. And she comes and nag. And then she started getting better. And she started really getting better. And her daughter said, I've never seen my mother as good as she is now. Amazing. She taught it. And the nurse was like, hiding. Because it takes time. Because I've done it before. It's not like, the first time I'm treating this. I've done it many, many times, combining medications, the right medication, the right dose, and keep the patient. When I was in Wales, I used to see the patient. I used to have a clinic for manic depressed, and we give them lithium. And lithium, it works long term and need to monitor it, whatever. So what I did, I brought every patient of mine to the clinic once a month. You usually see them every 3 months or 6 months. And the percentage of admission dropped by 96%. So it's amazing. I used to bring every month they come, they will have 1 month a physio talk to them, 1 month occupational therapist talk to them, 1 month a psychologist talk to them, 1 month the nurse talk to them, 1 month I talk to them. So 6 months they will have rotation of expert talking to them. And that reduced the relapse. And I take blood from them and check that. I came here and mentioned this story. One of the doctors picked it up and made a clinic in Birmingham, became famous out of it, which is good, because it takes time. It takes time and takes a lot of. So no energy, again, quite few, and then you go to eating too much or eating too little. 23 some of the time. I'm probably one of these. Eat too much or too little. Try to lose weight, then I became hungry and somebody invited us and we eat, and then we went to a wedding. I increased 2 kilograms the next day. So you're not laughing, you must be depressed, are you? I thought I'd crack some jokes for 2. 7 most of the time and 6 nearly all the time. So you have 6 plus 7, 13. This is why you need probably to get somebody to look at you. And treating you with medication, I was talking about this, it takes time. There's chance for relapse if you take medication. There's less chance to relapse if you get cognitive behavior therapy, because you are training you to control your symptoms and training open your mind to things and how life is run and what logic and what's not logic and what's will never happen, what can happen, and how you cope with it. So training you to be a healthy person thinking clearly usually take 12 weeks. But if you are doing it and the right person, probably 6 weeks is enough, 8 weeks is enough. Being full of energy, full of nervous energy, or moving much less than usual, 5 and 11 most of the time, nearly all the time. You see, the number is very few. So obviously, people, because they have depression or they had some depressive symptoms, they answer the survey. And those who are not depressed, they didn't want to waste time because they can make more money. It's like they said, Bill Gates, if he lost $100, he wouldn't bend to pick it up because he will lose $300 or $1,000 if he doesn't pick it up. So they have more things to worry about. They didn't fill the survey. So those who fill the survey probably are depressed, many of them. Now, oversleeping or struggling to get to sleep. Some of the time, 14, and never 10. 24 out of the 42. So you have 18 who actually all the time or most of the time. And that's a mark, that's a really big mark on depression, like having difficulty to sleep, or you sleep and you wake up and you stay awake all night, and unless there is really other physical cause. Being harsh on yourself or overly critical, self-critical, and people. So being harsh on yourself because of the guilty feeling depression brings. So that's make you punish yourself, this is why they commit suicide. Must be he caused all the trouble. Like I had a patient who want to go to America to NASA because he's caused trouble and things. Must be his thought, and because he used to work in NASA. Feeling low or under the weather. Feeling low has to be for 2 or more weeks. And our sample here, nearly all the time, 5 of them, and 13 most of the time. So you have again 18. Nearly half the sample I have are depressed, need the treatment. Now, when you look into considering harming yourself, that's really serious. So I sent that email straight after that, the first one, to ask people to go and seek help, because it's anonymous. I don't know who actually wrote, and I wouldn't know. It's difficult to get. I don't know whether some experts can find out or not, but there's no names, there's no addresses, there's no references, no emails. You fill the things and come to me. Now with my student, I ask them to put their names and address and S number, because they're doing a homework. So that's easy. I'm using this program I started using it, see if it works or not, because you can fill it very quickly. And 2 of them nearly all the time. So nearly all the time they feel depressed. Most of the time 2 of them. So 3, 1 nearly all the time and 2 most of the time. And feeling suicidal need to be taken straight away to assess. Some people might never kill themselves. Some people might never be able to kill themselves, but some by mistake might kill themselves. So this is need, you might try to, see what happened. It might be dead in no time. Headaches, cramps, aches, pains won't go away, especially when there is less education about medicine and about physiology and about, they might think, this because of this. And a lot of people who are suggestible, they get psychosomatic symptoms, and they might go to the wrong doctor and get treated. And it will be difficult if it becomes delusion, because if it's delusional, you can't shake it. It might go and waste a lot of money. And they talking to the wrong specialist. So here we have in the sample 13 never, but the rest does have. And if you say most of the time and all the time, is there's 9 of them. Lost interest or pleasure in things you previously found enjoyable. Again, if you take out the never 8, majority have lost some interest, but the severe one are here all the time, most of the time. Feeling energy, irritable, feeling angry, irritable, frustrated, even over small matters. Again, half the sample have. Slow thinking, slow in speaking, and slow in the body movement. Again, symptoms of depression. And if you want to ask questions, now here people, they thought they skipped that. It's not actually, you need to rate it, but they didn't rate it, so don't look at these results. Right, any questions, any query, anything you didn't understand? No.
So I think the challenge is with a lot of these things, I think everybody's experienced some of them at some point, maybe with the exception of self-harm, but the challenge when you speak to people about mental health and these sorts of issues is how do you know at what point it's actually a clinical issue and at what point it's just a normal.
There are certain symptoms must exist, like anhedonia, he's not enjoying anything, like poor sleep, waking up early in the morning, like feeling guilty, psychotic symptoms we don't actually brush away, and last for 2 weeks or more, and low mood in the person. So the low mood, and especially the mood, you need to really interview the person to assess the mood. But we have a key symptoms need to exist together for over 2 weeks. Otherwise, all the people will be depressed. Because you noticed a lot of people say sometime, they're not depressed. They had the experience, but they're not depressed, or never. When it comes to really difficult symptoms, they said never, because they never happened to them. But they had the low mood on Monday, low mood on Friday, low mood when I received the bills and things. Any more questions?
How come you never mentioned anything about taking regular exercise and all that? One way to cure or increase your feel-good factor is to engage in regular...
what we do in the cognitive behavior therapy, because people think they are good for nothing, and that's the end of them, they can't do anything, they're hopeless, helpless, whatever. We give them a chart, and write on the chart what you've done from since the time you wake up, and by every hour what you've done. Woke up, brushed his teeth, washed his face, had a shower, had breakfast, checked the mails, and all this, they fill it. So the more activity they fill it, they come with the chart. Oh my God, I'm doing a lot. While they used to think they're good for nothing, and they're losing out, and they're helpless and hopeless, whatever. So any activity, when you address it, when you're treating the person, am I, like I know, when I come to Fajr prayer, when Fajr starts 6 o'clock, then you see a lot of people running. I said, a lot of people running, and we are sleeping. We don't want to pray Fajr. What brought them out? The more activities you do. I mean, for Muslims, you will have 5 times in a mosque. If you are not near the mosque, take me 50 minutes myself, so I come twice already. But you do a lot of activities, and that adds up into lifting your mood. So whatever you do, obviously, exercise produces endorphin, and you feel high and elated. Yeah.
Yep. So if you know in family member who is feeling depressed, how you can help them, not only the clinical but from the environment point of view, what you can do to get. If
you are a family member and there's a member of your family is depressed, it depends how severe the depression or how dangerous. First, obviously, you probably might not be able to explore suicidal thoughts and things, but you notice that the feeding dropped, the sleep dropped, the activity dropped, withdrawn, they are lacking activity. Now,
Chef, would you recommend people go online and just check out PHQ Run?
Yeah, I just finished Khalid. Now, you need to know how to treat depression and how to advise. Otherwise, you might do more harm. Like when I talk to a depressed person, I don't talk about, he talk about suicidal things. I don't mention Jannah, heaven or hell, or I don't mention religion at all. I don't mention your sin, your being, sinning, drinking alcohol, haram, whatever. Because many of them, if they don't complain against you, they will, so that's it, I'm going to hell, so he killed himself. So you speed it out. So unless you know what to talk about, you're mad, you can't do this, same people will not do that. You make them even worse. So just going online, now I think a lot of psychiatrists see people through Zoom, isn't it?
Talk to me.
Yeah. You refer to psychiatrists and they talk to them over Zoom.
They do telephone trip, but they've started to see face to face as well.
I can't treat patients without seeing him. SubhanAllah, the minute I see the patient from outside, like I went to see a patient in Elderbrook Road, and first there's big cameras like the one in the Scotland Yard outside, and then a lady from inside looking into the curtain, she's so paranoid that she think they're chasing her, they're reporting her, and they have white vans passing her house all the day. So how many white vans you will see during the day in the street? Or one was in the high street when the mobile first came. They're telling each other about me. And that guy is talking to that guy, is talking to that guy. Yeah, when the internet came. So she said, the loft, they came and they installed net because it's World Wide Web. So she thought they installed the web in her loft. So by seeing the patient and talking to them, you get to the diagnosis probably the first few seconds or few minutes. But to assess the mood, to take really a good history about whether there's genuine psychotic symptoms. Because the minute you doubt what he's talking about, he will switch off and you miss the diagnosis. I went to somebody here in Sherry, and they installed in his stomach a bug machine. And they're monitoring him. And they're doing, is it? What the hell? Why are they doing that? Why would they do that? They tell you all sorts of stories. The one story I never forget, when I was new in psychiatry, he came in 1983. It was first time they talk about the sexual abuse of children, whatever. He said he's very upset, very sad because of this sexual abuse in it. And then there's this teacher in the school where his daughter goes and he was abusing children. And one daughter told her mother, and they put undercover agent, and they discovered them. They caught him red-handed and things. And and I was following the story. And then I said, how did you know? He said, that's easy. There's electrode implanted in my brain. I intercept the police messages. And I laughed. I shouldn't laugh, but fresh to psychiatry and somebody telling you this. Later, what is it? How does this function? And then you get more symptoms. You get more symptoms till you fix the diagnosis. Going to NHS side and look into, probably if you are not really depressed, might help you get out of it. Probably if you are really depressed and you need treatment, it depends on the person. Some people who are very worried about themselves and they get anything, to think that, that's it, I'm getting this cancer, I'm getting this heart attack. There's people who say, no, never happened, don't worry about it. And there's people in between. But being a psychiatrist, I would say, no, get him seen.
This is the specific it's a survey, it's a PHQ-9 survey. So if you go online, you can search it, PHQ-9. You answer the questions, and it will tell you if you've got, if your answers are suggestive of mild, moderate, or severe depression.
If I know who is that guy who's scoring nearly all the time, because you need collection of symptoms. You don't rely on one or two. You need
9 questions.
Yeah, you need collective of symptoms and to last for 2 weeks, and then you say he's depressed. But even so, you still need to assess the risk, and that also from key questions, and then how quick, how pressure you need to put, what services you need to link him to, and how quick this service. Like I had a phone call from a GP, said this lady want to kill herself, and you must be seen today. So it happened I was in the building just opposite to her house. So I saw that patient, came down, took me around 7-8 minutes, knocked on her door. From the window, she's sitting there watching the afternoon matinee film, and she with the coffee and biscuit and things, and nothing wrong with her. She was so amazed that I knocked and caught her red-handed, more or less. So I phoned the GP and said, I've just seen your patient, and I know what she needs. She's lonely. So we had her many times. She went to the casualty many times. And then we decided, I said to the team, look, the only way you can get her better, send a CBN to see her every 4 weeks. How are you? You have tea with her and coffee, whatever. And that worked. For 2 years, she didn't go to casualty. Then I retired, got rid of the problem. Any more questions?
I just wanted to ask about the actual, you talked about assessment and people getting assessed if they think they're clinically depressed. What would they need to do then if they're actually to be assessed? Do they need to see their GP, or how would that actually happen for someone to get assessed?
Yeah, we have quite few GPs here, we can tell you. What would you do? What would you suggest?
Yeah, so go to GP.
Go to your GP.
If you can get an appointment.
If you can't get an appointment.
I
I had, this is a true story. Yeah. This is a true story. I had a referral letter put on my list, and I went, took the letter, I said, oh, I must see him today, because sound really, and I went to see him and knocked on the door, there's nobody in. And the neighbor said, oh, he killed himself 2 weeks ago. Then I went to the team. Who saw the letter when it first came from the GP? Then we made major change. No letter will be seen by a nurse alone or OT alone, whatever. It has to come to the meeting. At least must be one psychiatrist there, one CBN, at least one psychologist, because you need to decide. One person cannot decide about it. And alhamdulillah, I mean, I made that change in the service, which is, Any more? There's a question from you.
I'd like to ask a question in terms of the topic's been really good. What do you find within sort of our community and the Asian women is that there's this denial that they might be clinically in depression, and what you find, well, what I've seen is that they, rather than seek medical help, they are seeking the help in the wrong manner in terms of perhaps seeing another Maulana for the wrong things, if that makes sense.
When you see, especially Asian, when you see Asian with a lot of psychosomatic symptom unrelated, usually pain here and pain here and pain here, and then I have a stomach problem, and then I get numbness here, and then you start looking into the second line, which is mental state, and then you start directing certain questions. The problem with denial, lack of knowledge, a lot of wrong information about religion, the shaitan and the jinni and this and that. Two mullahs in Manchester, they tried to get the shaitan out of the girl, and they kept hitting her. They killed her, and they went to life imprisonment. So in this country, you have different delusions when it comes to delusions. But when it comes to depression, in the Asian countries, mostly come with a lot of physical symptoms, and this reach the stage. Sometimes they have dissociative behavior. They switch off. They're not answering. They don't want to do anything. I went to see a lady. I mentioned that thing in the halaqah here. She was hanging on the bottom of the couch. She wouldn't sit on the couch, and she was so upset and sad that she dissociated herself from everybody. She didn't want to talk to doctors and nurses. But education, you need education. You need education. People realize that it could be a mental illness, could be depression, could be an anxiety, could be bipolar affective disorder. They come. They could be protective. I have a friend, a close friend of mine in London, when I came to Britain, he gave me the key of his house. He said, just pay the rent and sit. And they had a schizophrenic in the mosque. And I said to them, you need to refer him for treatment. Need to refer him for treatment. No, we can contain him. You can, in a religious setting, like a psychotherapy setting, there's community setting and things. They treat on long term in therapeutic community. But they couldn't treat him. They don't know psychiatry, so they ended having the guy went to the police and tried to burn the mosque. And he's psychotic. Don't try to solve it. You need information, you need knowledge, and knowledge will get you. You know, the difficulty, you can't get people to say you are very depressed or you're schizophrenic. You can't say this to them. They can indirectly direct them. Now,
just worth adding, just like physical illness, you don't have to reach a state of clinical depression in order to do something about your mental health or look after your mental health. There's something called mental well-being, and it's becoming more of a kind of widely talked about, discussed topic. But actually there are things that you can do for your mental health just like you do with your physical health.
yeah, that's when you advance in knowledge and you advance in, standard of living, then you can address issues early. While in poor countries and less educated countries, they can't pick it up until it's the end stage. This is why in Britain there were more black and Asian people put on sections of mental health act to take them to the treatment, because they were not spotted early, and when they not spotted early, it kept get worse and worse and worse until things really over the top, nobody could tolerate. Then they get that team involved. While in most educated areas, I mean, even the neighbors. We went to see a lady here in Shirley, and she wouldn't open the door. She wouldn't allow anybody in. We can't assess her unless we see her face to face. We are not allowed to section somebody from behind the glass. So we asked the neighbor. They said 4 o'clock she get the wheel bin out, and it's tomorrow the collection. So wait. So we waited in the cars till it's 4 o'clock because she had a French door, and the police said we can't break it. They can't break ordinary door. So we waited in the cars until she came out with the wheel bin, and we went and saw her and put her in section, took her to hospital. But I saw a patient in Noel. She wouldn't allow anybody to see her, but me. But I need the team to see her and listen to what she says, so we could say whether she's mentally ill, need to go in section or not. So I put my foot in the door. And she tried to close the door, my foot there, until I was talking to her. No, I don't want to see these people. Let them go away. And then I kept asking the key questions until, we got it. Jeez, need to move. And then I removed my foot. It's risky, but one in Wales, she was so angry that she opened the window. She wanted to tell us to get lost and things. What she did, I mean, in Syria, we have, when I was doing my training, the wife of Rafat Assad, who was the brother of Hafez Assad. Then he's in exile now in France. His wife was training with us, but she comes to the hospital with cars with no number plate. So they came, Bejo, and then she and the bodyguards with her, number plate, no number plate. So when I was in North Wales, there were a schizophrenic moving around, and she removed the number plate because she doesn't want the police to know her. So I said, must be that one was. So anyway, but she wouldn't let us get into the house, and she was quite angry. She opened the window to shout at us. Okay, we saw her without window. Because the law will not allow you to. Yeah. Any more questions? Shall we close? Thank you very much for coming. That was really nice to see so many of you.